Welcome again. It's so nice to see so many of you for the 10th time, and it's really so nice to see some of you for the first time. I'm Carla Shepard-Rubinger. I'm the Executive Director of ABM, and my only job here as Vanna White is to introduce the Summit Chairs. Dr. Ruth Lawrence, who, for most of you, needs no introduction. Dr. Lawrence is one of the founders of ABM. She is the Northumberland Trust Professor at the University of Rochester in pediatrics. She does believe that University of Rochester is the center of the world on breastfeeding, and it probably is because of her. And we are really grateful for her continued support and work with us. We also have a Summit co-chair, Tim Tobolic, who is the current president of ABM. He's a family physician in Michigan, and we are grateful for him to be the co-chair of the summit, the president of ABM, and most importantly, the one who records in photographs all of what happens today. So smile when you see him, and I will turn it now over to Dr. Lawrence. Thank you.
Good morning. I was told I should remind you about this card. So I thought I'd start by reminding you about this card that's in your folder. Be sure to fill it out, and more than anything else, be sure to leave it with us when you fill it out. So, and my job this morning is just to welcome you here. We've been meeting for 10 years. Why aren't we done? Well, because this is an area that has been moving so fast that it's very hard to keep up with it. We started many years ago with the Surgeon General, C. Everett Koop. I don't know how many of you had the privilege of ever meeting him, but you'd never forget him. He chose Rochester. That's in upstate New York, by the way, and asked us to put on the first Surgeon General's workshop in Rochester, New York, invitation only, and we had the opportunity to invite some wonderful people from across the country. And he was there in his white uniform, his sword by his side. It was intimidating. But it started a movement to pay attention to breastfeeding. And it's historically, we've made a lot of progress since that time. This document was published. I don't know how many of you have seen it. It was published within 6 weeks. Those of you who work in the government know that getting something published in 6 weeks, much less 6 months, is a miracle. But this was published and on the market in 6 weeks, and that was the energy that C. Everett Koop put behind breastfeeding, and we have followed him ever since. We established the Academy of Breastfeeding Medicine. Many board members are here this morning, and the Academy of Breastfeeding Medicine is an organization of physicians that support breastfeeding. Now that's very important because there are lots of organizations that support breastfeeding, but up till then, physicians had not taken much time to think about it. So that made a difference also. So now we have come 10 years later, and looking back through the history of breastfeeding, and you can read about it. 2,000 years ago, breastfeeding rose and breastfeeding dropped. When there was money and opulence, women didn't breastfeed, they paid somebody else to do it. When there was poverty, women breastfed. And the same is true today. We have made a big difference. 80% of women are leaving the hospital breastfeeding their babies. The trouble is, it doesn't last very long. They still don't have the support they need. So there are a lot of things that we have to fix. And we don't want to throw this under the bus just because we've achieved such wonderful figures so far. So our task here today is to look at the issues. And we all represent different organizations that have the capability of influencing people in the healthcare system. So when we work together, I hope we'll have a plan by the end of the day tomorrow. But in any event, we will be able to communicate with each other. And I welcome you here. Have fun. It's not supposed to be an agony. And speak up when you have something to say. Thank you. And Dr. Tobolic, the podium is yours.
Thank you. I'm Tim Tobolic. I'm president of the Academy. This is the 10th Academy. I've been to many of them, but not all of them. I didn't come to the first one, but I did meet C. Everett Koop many years ago. Sat down and talked with him. Amazing man. Most of the discussions I have, and most of us have been around physicians and with our patients, but in this room, this represents a significant, diverse group of committed people who are committed to breastfeeding and supporting breastfeeding, excuse me, and whether it's economic, public workforce, public health, global issues, this group is different than most of the times that I, as a physician, meet and discuss things with about breastfeeding. We have had stakeholders at these meetings from a variety of different institutions, federal government agencies, nonprofits, foundations, academic centers, physician organizations, economic institutions. So there's a diverse group of people who've been meeting at this summit for many years. And so welcome, and I hope you leave this conference with a sense of urgency for continuing what we're doing. I'd like to recognize a couple of different groups and people. One is the Kellogg Foundation for establishing their mission to support programs that help vulnerable children to thrive, and especially this conference and the ABM, and help strengthen our support for breastfeeding. Carla Shepard-Rubinger, stand up, Carla. She was here already, but you have to understand that most of this, she puts this program together. She has established and maintained, you can sit down now. She's established and maintained relationships with many of you and many others who've been to previous conferences or summits, and she ties this all together. And that lady in the back, Norma, who silently works in the background and also puts most of this together. And one other person who's also sitting in the front row, and you've already met her. I met Ruth about 17 years ago at one of the first ABM conferences, and she invited me to sit in on a meeting that turned out to be our fellowship meeting, and she's influenced so many people, and I would dare say that globally, and I dare say that if there's been any significant improvement in global breastfeeding, at least she owns part of that. So thank you. First speaker. So we'll get on with the speakers. You don't want to hear any other talks. Dr. Valerie Montgomery Rice is president of the Dean of Morehouse School of Medicine and first woman to lead that's freestanding medical institution. She's an OBGYN and recognized as an infertility specialist and researcher. She received her BS in chemistry, and I did too, so good job. From Georgia Tech and her medical degree from Harvard and her completed residency in OBGYN at Emory. She works with programs which diversify physician and scientific workforce. She's received many awards and accolades for her lifetime commitment to education, service, and advancement of health equity. Dr. Valerie Montgomery Rice.